This is Vitl, the at-home blood test that claims to give you personalised recommendations on supplements and lifestyle from just a single finger prick. I've tried it and will let you know what I actually found. Vitl sits somewhere between a supplements and a diagnostics brand, but it's definitely closer to a supplements brand. It sets out to give you personalised recommendations on what vitamins you should take based on a vitamin test and even your DNA, because it reckons that the more personalised you can be, the better. The problem it's trying to solve is real. A lot of us just take random supplements, maybe a multivitamin, or some people take none at all. And deficiencies, especially iron and vitamin D, are really common. But the bigger question for me is whether we actually need personalised recommendations on which vitamins to take, or just better guidance. Let's talk about the testing experience itself. It's all pretty straightforward. They give you a pack full of lancets. You test by pricking your finger and then putting the blood into a vial, which I found pretty easy. However, I did have to do the whole experience twice. So my fingers were like little pin cushions, and it is quite a lengthy process depending on how good you are at squeezing your fingers. It takes about 15 to 20 minutes each time. But the problem was the first time I didn't register my pack, so they weren't able to process my sample, which was obviously really frustrating. And I felt like I'd read everything correctly, but apparently not. But I do feel that for 80 quid, it should just be really straightforward and it should be easy to get this right. And clearly it wasn't. We'll blame user error for this one. However, the bigger gap for me was what happens when you get your data back. It flagged that my vitamin levels were all pretty good, except my vitamin D, which was at the lower end of what's considered healthy. And it recommended that I could take a supplement. I had expected that then it would recommend the supplements for me and perhaps a dosage that would be required to get me up to the optimal level, but it didn't, and that just felt like a missed opportunity. The other area, though, that really felt like it was lacking was around the cholesterol testing. Now, I've done several cholesterol tests and I know where my levels are at, but this test flagged that my cholesterol, my triglycerides specifically, were really high and that I should see a doctor within the next 7 days. And it felt quite alarming in the way that the news was delivered. However, I know that my triglycerides were probably affected by the fact that I hadn't fasted quite long enough, so I shouldn't really be worried, and generally speaking, I wasn't. But I do think for someone who hadn't been through that process before, they need to be better educated through this process, not to panic. It's also worth mentioning that the pack and the brand are quite nice. It feels on the right side of clinical, on the right side of lifestyle, but there are a few details that let it down, and I think it's just a good reminder that when you're producing something in health tech, we need these little trust signals to help make it feel the right kind of clinical. And having an elastic band wrapped around everything just makes it feel a little bit less considered, especially for 80 quid. At least get a yellow elastic band. So the biggest gap for me is what happens after. Because of the whole brand promise around these personalised recommendations for vitamins, I just expected that there would be a personalised recommendation for what I should do next, both around my lifestyle and any personalised vitamins. It didn't feel like the user experience was continued after the initial recommendations that appeared on my online portal. In terms of trust and data and credibility, overall, like I've said, it feels like it's on the right side of clinical versus lifestyle. They're pretty open about their data practices. They make it clear that they only capture what's necessary, which is blood biomarkers and the questionnaire, which takes your sort of lifestyle information and a bit of history. Overall, it feels transparent, but not particularly deep on how it explains what's going on behind the scenes. If you're wondering if Vitl is right for you, I suggest that it's best for people who are fairly early on in their health diagnostics journey, maybe someone who wants an early snapshot of where their vitamin and cholesterol levels are at so they can start to make some lifestyle changes. If you're after really deep information, this is not the test for you. You can get a lot of the same information from your doctor or from a much cheaper cholesterol-only test like PocDoc. So this really is about lifestyle and convenience, so it matches up quite neatly with the brand promise. Overall, I think this is a decent entry point into at-home testing. It's a bit shallow in some places and the experience could be tighter. I'd give it 6.5 out of 10. If you found this useful, I will be reviewing more health tech products in this space. So if you're building or using health tech products, this is for you.